this is episode 3, Tips to Ace Your OSCE, where we share everything you need to know one of the most important exams in your pharmacy journey. Before we dive into strategy, let's clear out a common confusion, the difference between an OSCE and OSCE.
OSCE, or Objective Structured Clinical Examination, is a performance-based assessment used primarily to assess clinical performance. They test not only pharmacy knowledge, but also the consultation and communication skills needed to successfully treat patients and work with other healthcare professionals. OSCE, or Objective Structured Practical Examination, on the other hand, is a standardized assessment method used to evaluate a student's practical skills and knowledge in a structured, objective manner. It involves stations where students perform specific tasks and demonstrate their understanding, with each station assessed according to predetermined criteria.
In this episode, we will be focused on the OSCE by sharing the preparation and during the OSCE tips to help you get ready. Stay confident and perform your best at every station. Let's get started. Let's begin with some preparation tips. Being well prepared before the OSCE can really make a big difference in your performance. Tips 1. Know your reference. Familiarize yourself with the drug reference like MyPSA and the British National Formulary (BNF). These resources are essential for quickly the checking of drug application, dosage, interaction, and concentration, especially when you are under time pressure during the exam. Tips 2. Create a template for patient medical and medication history taking. Having a clear structure helps you to stay organized and ensure you don't miss any important information during the station. Here's a useful template to guide you through the counseling process. First, introduction. Start by introducing yourself and explaining your goals to build rapport and trust. Then, confirm the patient details such as their name, age, gender, weight, height, BMI, and even the registration number to ensure all the patient's details are correct. Second, medication history. Once you have confirmed the patient details, start with the shift complaint (CC). Ask what brought the patient in today and try to understand the main symptoms and concerns. Next, move on to the history of present illness (HPI) by asking about any ongoing medical condition they may have, such as hypertension or diabetes. Oh yeah, don't forget to ask about their family history (FH), which will help you to identify any hereditary health risks that may be relevant. Now that you have got a clearer picture of their medical background, right? Let's move on to their lifestyle habit by taking the social history. Ask about their diet or lifestyle, occupational, alcohol intake, or even a smoker habit. And of course, always check for any non-allergies, especially the medication allergy, as these are crucial for safe and effective treatment. That is about the medication history. Next, it's the time to explore medication history. Ask the patient about the medication they are currently taking, what they are, how often they take them, and whether if the medication are effectively helping with their symptoms. Oh, don't forget to ask if they experience any side effects, as this could impact their treatment of experience and overall health. After gathering the medication history, move on to the assess medication adherence. Find out if the patient is taking their medication consistently as prescribed and whether they have any support such as the caregivers or family members who help them to manage their medication or overall health. This step provides valuable insights into how well the patient is managing their condition on a daily basis. Follow this step-by-step approach not only keep your counseling clear and structured, but also show your professionalism and attention to details during the OSCE. Tip 3. Rehearse with case scenario. Like I always say, practice makes perfect. Try role plays with friends by using the sample OSCE cases. Focus on your counseling flow, management, and communication skills. Oh, don't forget to ask for feedback too, so you can identify areas to improve before the real exam.
Alright, now that you are prepared and practiced, it's time to put your skill into the test. I'm Memphis and I will be sharing some of our tips for you throughout your OSCE test. It's normal for the OSCE test to feel intense, but with the right mindset, in moment tips, You will be able to stay calm, confident, and focused at every station. So now, I will be sharing you 5 tips to do your best at OSCE test. Let's dive in!
Tip 1. Read and identify the asset requirement. Before doing anything, pause and read the station instruction carefully. Highlight key action. Are you counseling, taking a history, or demonstrating something?
Okay, counseling a patient on inhaler use.
Tip 2. Use correct professional terms. When speaking with a simulated doctor, use proper clinical terms. Show your understanding like a future pharmacist.
Good morning, doctor. May I come in?
Yes.
The patient is hypertensive and is currently on amlodipine taken once daily. Are there any instruction or concern you like me to emphasize during the counseling session?
Tip 3. Use layman terms. Patient may not understand medical jargon. Translate your knowledge into a simple and clear language.
This is from Seven and MyPSA. One of you that help you to remove extra water from your body, which can lower your blood pressure and also help your heart work better.
Tip 4. Read and close professionally. Always begin and end with confidence. It shows professionalism and builds patient trust.
Hi, I'm Pharmaceutical and I'll be answering you today with your medication and any concern you might have. Miss, how do you feel today?
I feel very tired.
Do you have any symptoms?
I think headache and also flu.
How have you been having any kind of flu?
Around 2 days.
Take up your time. Please take care and let me know if you need any help again.
Tip 5. Dress appropriately. First impression matter. Dress like a healthcare professional with a white coat, cover shoes, and a neat appearance.
And that's a wrap for OTC episode 3. Tips your Ace Your OSCE.
For preparation strategy to during the OSCE tips, we have found something useful to boost your energy and your performance.
Remember, OSCE isn't just about what you know, it's about how well you apply your knowledge and communicate under pressure. So, stay calm, be professional, and believe in yourself.
You have worked hard for this and you have got what it takes. Just take a deep breath and give your best at every station.
Thanks for watching, and if you found it helpful, do share it with your friends or bad friends.
Good luck in your OSCE test and we will see you in the next episode. Bye!
Bye!